Hi, I'm Ed from Queensland Ambulance Services. Can you hear me? Can you tell me where you're in pain? As a paramedic, I'm the first one to see the patient and am therefore a crucial part of the healthcare journey. I provide the important initial care, including a primary and secondary survey, to determine their condition and the extent of any injuries they might have sustained. It's also important to keep them calm, especially in a situation such as this. We also provide the initial treatment for the patient. The more information we can find out and the better care we can provide, the better their entire healthcare journey will be. We've got Patricia Jones, a 68-year-old female. She's got suspected hip fractures, left forearm fracture, and slightly hypertensive with 170/110. During hospital handover, I have the responsibility to relay all the crucial information for the other health professionals. We need to choose which case information is relevant to tell the nursing staff so that they have everything they need to provide comprehensive care for the patient. It's important that we give an accurate account of all relevant case details and any treatment they have received. Without this information, other health professionals may not be able to complete their roles as efficiently, effectively, or safely.
Hi Patricia, how are you after your surgery?
Yeah, I'm a bit sore, but got me to go home and see my family.
As a nurse, I am the primary point of care for Patricia on her arrival to hospital. It is my responsibility to ensure that I am using the best available evidence for safe quality practice while responding to the health and well-being of my patients. I work closely with other health professionals like paramedics to make sure we have the best health outcome for the patient. The emergency department allocated me to receive Patricia on arrival to hospital. This process is important as I knew to assess Patricia's condition right away with the help of paramedics so that I could take her to surgery as fast as possible. I'm also assisting Patricia after her surgery, managing her pain levels and monitoring her vital signs as she comes out of anesthesia. It is critical that I check her wounds for healing and signs of infection and try my best to help her be as comfortable as possible.
As Patricia's long-standing podiatrist, I have been with her for many years helping her manage her comfort and stability in her lower limbs, mainly focusing on care for her osteoarthritis and in her joints and the hallux abductor valgus on both of her feet. Before the accident, we were planning on having a resection arthroplasty on both her feet to cure her HAV and allow her to walk with minimal pain or discomfort. With her hip fractures during the accident, replacement and care of how she manages these replacements took priority. To cater for these new injuries and replacements, I have instructed Patty to walk for 10 minutes each day and to wear compression stockings. The hip fracture she experienced in the shower in her own home after the accident was managed but not replaced or operated on, as chemotherapy and radiation therapy was destroying her immune system, and a replaced hip can cause serious post-operative infections.
Hi Pat, I'm Ari, your radiation therapist. So as you know, we've taken some more scans and the cancer hasn't responded to the treatment. You have the option of radiation therapy to cure it, but this involves long-term treatment with high doses of radiation. If you choose this option, we'll do everything we can to cure you of the cancer, but the nature of the condition means we can't guarantee anything. The other option we have is palliative care. This will give you smaller doses over a shorter time frame. The aim of this won't be to cure the cancer, but it will relieve as much pain as possible.
I just want to go home. Not being able to see my family and spend the time I have left with them is just painful. I know they're just trying to help me, but quite frankly, I just want to live the rest of my life peacefully and live without any regrets. After talking to the radiation therapist and knowing that my condition has worsened, I knew my choice. Either spend more time in the hospital or have palliative care and spend my time comfortably in my home and with my family, more importantly. Losing Solly was already traumatic for me, so right now, for me, my main priority is spending precious time with them.
As Patricia's pharmacist, I am responsible for her pharmaceutical safety and care. My job is to educate Pat on what medication she is being prescribed and why she is being prescribed it. In addition to this, I must communicate with the patient to find out any medication she is currently taking and if she has any allergies, to ensure she has a positive reaction to the medication that I prescribe to her. Since I am part of a healthcare team, I must also communicate with other health professionals to learn more about the patient's condition so that I can treat her appropriately and effectively. Pat had several fractures and contusion injuries from her seatbelt, and therefore I have decided to prescribe opioids for pain relief. Due to Patricia's diagnosis, I also bear the responsibility to provide palliative chemotherapy to her in an effort to increase the time that she has left.
With Patricia choosing palliative care, we immediately began planning the best course of action. She'll have to come in frequently for MRI, planning scans, and her treatment. However, I've planned with the other professionals to help return her home as soon as possible. She'll see her podiatrist to manage her injuries and increase her mobility, while the pharmacist will provide pain relief and any medication needed to counter minor side effects. Overall, our plan really is just to help enjoy what time she has left with her family.
I'm slowly regaining independence with regular exercise and the help of my long-standing podiatrist. It's also comforting to see a familiar face occasionally. I was grateful that I was given a choice by the radiation therapist, allowing me to be in control of my own healthcare. I'm also grateful for the help from the other health professionals. However, I still stand by my decision of going back home. I've accepted my condition and would like to spend my remaining time with my family. William needs me back home, and so do my grandkids. Can't help them while I'm at hospital undergoing treatment.
Home and